2020. Welcome, everybody. And first order of business is public comment. Kathy, do we have anybody who wants to speak to us?
No, I did not receive any requests.
All right. But it's my understanding at this point that if somebody does, we now have a system that would allow us to take real-time public comment.
That's correct.
This is public comment. Okay, good. All right, any changes to the agenda?
Just mute yourself.
Okay, hearing none. We have minutes from July 16th, 2020. Could I get a motion to approve the minutes? Thank you, Glenn. Mike, do you want a second? Thank you.
Yes.
Any
second.
questions or comments about our minutes? I'm depending on you too. Any questions or comments on the minutes? All right. Ready to vote. Mike,
Aye. Yes.
Glenn,
Yes.
and the chair votes yes. So we have passed the minutes. Chair's report. I don't have anything other than I think we're going to have some topics of discussion in county administration, and we'll get to them momentarily. So I suggest we just keep moving. And I welcome our county administrator, Jason Molino. There
Great.
in your box. Welcome to the meeting. And we have on the agenda police agency coordination, COVID-19. Did you want to introduce that, or we
Sure.
can start talking about that
So
issue?
There's two issues we have to update. One is on the enforcement and some of the enforcement changes that have happened, and Amy's joined me as well, and we can talk a little bit about the past few weeks as we've worked on a little more of a coordinated focus with environmental health, sheriff's office, and some other agencies in the county regarding enforcement of large gatherings, primarily, large gatherings and non-compliance with mask wearing and physical distancing. The other thing we can update on is the police reform efforts that we've all been a part of. That includes also the sheriff, undersheriff, myself, you, Rich, Amy, and some other folks. So why don't we start with those and go from there. About 3 weeks ago, we started to materialize an enforcement approach, and after a series of different dialogues, bringing in law enforcement to assist with enforcement of large gatherings, mask wearing, physical distancing, and anticipation of students coming back and probably an increase in large gatherings. After multiple conversations with different agencies, most agencies are willing to do that enforcement in their communities. With respect to the city, city IPD was not willing to do that enforcement. So needing a solution, spoke with the sheriff and undersheriff and decided to put on several additional details, one detail a night on Friday and Saturday nights so far, to assist with any calls relating to large gatherings. So that's happened 2 weekends in a row now. Amy, I'm going to turn over to you. She has some information about just what's the results of those, the details. Nothing huge, but I'll let you kind of share what the results of them.
Sure. So we've been, as Jason said, doing this enforcement detail, working with the sheriff over the past couple of weeks. From that, I can give you a quick breakdown on what that's looked like. The first grouping of the weeks, August 3rd through 9th, we received 5 total complaint calls. Of that, 3 were gathering related and 2 were masks and distancing specific. The sheriff's department did respond to all 5 of those gatherings. 3 of those complaints were located within the city of Ithaca. The other 2 were in Danby and the town of Ithaca. Of the 5 complaints, only 1 was attributed to a student or students at a higher education institution, and then violations were not observed at 2 of the 5. So 3 of the gatherings did have that, or 3 of the complaints, I should say, they were not all gatherings. In August 10th through 16th, we received 3 complaint calls. None of those were gathering related. All 3 were mask related. Again, the sheriff responded to all 3 of those. They were all located within the city of Ithaca, and violations were only observed at 1 of those 3. And then as we move into this week, we have received a few complaints. I have information from Monday and Tuesday. We have received 2 complaints. Both were mask and distancing complaints. One was in Cayuga Heights and one is in Trumansburg. Their respective agencies responded to both of those. And only one of those actually had confirmed that there was a violation there. So that's what we're looking at as far as magnitude at this point. I do know that, again, we are moving into more of a busy time in the next week or so. So we'll continue to watch and see what that looks like. But that's been the uptick thus far.
Amy, thank you. And I guess I'd like to just make sure I put on the record how much I appreciate the work that county administration and the sheriff's department and the health department have done in putting this response capability together. I believe this is critically important from the standpoint of all of the members of the public that are highly anxious about the return of the students in particular, but also about what's going on in the community and whether we are keeping each other safe. And without some credible way to do the check on this, I think we would have some real public backlash. As I've said repeatedly in public and in emails, I would like us to have a countywide, consistent, coordinated response with lots of other agencies. It sounds like you're working on that. You know, I'd like us to get farther along on that, but I'm really proud, frankly, that the county has stood up and is doing what it's supposed to be doing. But I'll see, anybody else have a question or comment? Oh, a quiet bunch today.
Actually,
Yeah, Mike?
yeah, no, I guess it was kind of my understanding that the sheriff's department would be responding to like parties and things like that. I guess I didn't know we had gone quite, like that's really kind of a step further, responding to mask complaints. Can you give me an idea of what, you said that a couple of people were actually cited or they found out that, yeah, there was a valid complaint there. What happened after that then, I guess?
So we're still at the point where we're doing the education piece. And so it's educating on that. The sheriff's department created kind of a form that we provide to them that is then provided back to the campuses or as well as environmental health. So only campuses, obviously, if students are involved. But it starts with that education piece so that people understand that they are in violation.
Okay. Martha, did you have more, Mike?
Well, no, I guess it just seems like if somebody were to call in a mask complaint, that wouldn't last even enough for somebody to get there to respond. I mean, unless the person stays in the store for some reason and that's the complaint, I guess I find it hard that I guess I'm curious as to the nature of what those calls even look like.
Yeah, I mean, let's be honest, we're not responding to every mask complaint that comes in either. All right, I mean, where the resources are available and we can, we do. And where there's another detail on, particularly the one in the city, and that's generally probably part of the response to the gathering and it's identified, then we do. Everybody that calls up that says, I saw someone walking on the street with a mask is not going to get responded to.
Yes.
But this is more of a larger issue, focused on gathering than it is anything else. So, I mean, I don't want you to think like there's a mask hotline where, you know, anytime someone walks down the street and they don't see a mask on, we're going to respond to it. That's just not practical.
And I will say, just to clarify that while masks and distancing can be part of the complaint, these are all related to a large grouping or grouping. So there's different ways that they call them in. And so while it may not be necessarily that gathering was the first thing identified, it may have been masks were identified at a gathering. So it is still pieces of that.
Okay, that makes a lot more sense to me. Thank you.
Yeah.
Great. Sorry we weren't clear on that.
Sorry about that.
No, not your fault.
Yeah,
No, thank
Martha and then Glenn. So Martha?
Yeah, Glenn, go ahead. You're a committee member. I'm not.
Well, just one question for the sheriff. It's my understanding that the only police agencies that are refusing to do COVID-19 complaints are Kego Heights and Ithaca. Is that correct?
Not entirely. It's just Ithaca Police at this time. Kego Heights has been fully cooperative since the get-go.
Oh, that's good. Okay. Are we really also increasing our liability and our risk and by doing this?
Well, anytime Derek comes to work, it's a liability, right?
Well, I realize this, but you know that you see the stuff in the news, Jason.
Yeah,
You know, all the people are getting a little upset when people show up at their door,
I know.
say that you have to wear a mask, and they say no, we don't, and then all of a sudden things happen. I mean, and that's to me, it's increasing the risk that we have already.
It is. I'll let Derek talk a little bit about, I mean, the approach that they're taking, which is not a forceful approach. Before Derek goes, I would say, Glenn, that to not do anything is not necessarily acceptable either. So there's a balance of what do we do? Is it a reasonable? Is it the right thing to do? It's education focused, but you know, to not do anything with this, I think would also be a liability on our part in terms of community health and public health. But Derek, maybe you can explain a little bit of the approach that the deputies are taking, and that may help give an understanding of what's going on.
Yeah, certainly. The approach we have taken is extremely hands-off. We do respond to the calls, but our deputies have been instructed that we're merely there for education at this point. We're not taking enforcement action. They were even instructed to the level that if they meet any level of resistance, to just gather the information they can and simply walk away. So far, taking that approach has seemed to work. We haven't had any issues. We had one person where we responded that was upset, but it was less so with us, and he was more upset with his neighbor and made an accusation that it was an unjustified complaint simply. We haven't had any issues so far, and like I said, it's a very hands-off approach. We're doing the minimum we can just to educate people and then share the information with the health department.
I should add to that, part of the sharing of the health department, there is a component, and the sheriff's office did a great job developing this form that allows it to be shared with the health department. And if there is a higher ed connection, it goes to that appropriate office that follows up. And then there'll be a follow-up on our part to them at some point saying, all right, what happened with this? Right. So at the very least, if there's reason to step away, the officers have the information, they've got the address, they've got, if there's any identification of individuals, that information's then passed on to higher ed if there's a relationship there. If there isn't, and right now the majority of these aren't, but if there is, there's another mechanism of accountability for them to follow up on their student compacts or contracts or whatever they're calling it, depending on the school.
And just one further clarification I hadn't thought of, and Liz just reminded me. One of the reasons that gathering is a major complaint is gathering over 50 would be that complaint, whereas the smaller gatherings where social distancing and mask wearing would be the other complaint. So there is a very specific gathering piece. There's the over 50 gathering, and then there's the under 50 with no social distancing. So that's just further clarification on that there are two different forms of gathering.
Rich, can you put me on that
Martha?
list too? I'm having technical difficulties, but.
Okay, Anna, welcome to the meeting. And you say you have questions?
I just had one. I just wanted to be on the list, but I apologize. I'm having some severe technical difficulties. Hopefully you can hear me.
Sort of. But why don't we have Martha go? Jump in.
Thank you. We'll see how good my tech is. A couple of things. One is, can we do a sort of maybe weekly public relations, public statement, or maybe it can go on the health department website for a couple of reasons, so that people know that people who are worried know that we're actually doing this, and people who aren't worried know that we're doing this. So that the people who might think, hey, this is fine, might getting the message that it's not so fine. Yep. On a gathering that is more than 50, they could, I presume they could also have a violation about masks and social distancing, right?
Yes.
Okay, so that would be combined. And I guess I'm also wondering, second time around, is there, if you end up at some point, maybe we'd end up visiting the same house twice, is there a fine in that case or any increased enforcement?
So we have talked a lot about that. There are things that we can do to increase enforcement. As we get to that and approach that, I think there is a further discussion because as has been our case with all of this, education's primary, but there is that secondary and it is a risk to public health. So I think as we get into that, we've definitely been in consultation actually with Matt as well as Jonathan in the sheriff's office and others to think about what that would look like and how we could actually do that. So there is the possibility for that.
All right, let's hope we don't need it. And then, oh, I had one other piece. I've lost it. All right, if
we can go back to Anna.
Right.
Yeah, I was just curious, Amy, if it is a party that is over 50, would there be I'm assuming the protocol would be different. Would it be that the sheriff would contact Liz and the health department, or would they give a citation themselves? I'm trying to figure out what the protocol would be.
So in all of these cases, the sheriff is working with environmental health. The sheriff is a real-time response mechanism. Environmental health is not. And so that's an important clarification on how we've created this. In all of these cases, I believe, and Derek can talk more about this, the sheriff would ask them to disperse at any of these gathering sizes if they're the large gatherings, and then they would provide the same information. Derek, I don't know if you want to add in there.
Yeah, certainly. If a complaint comes in, loud music or a loud party, nothing is mentioned about public health risk, we will still respond like we always do. If a public health violation is observed, we will also do the form we were created and send that to environmental health.
Thank you.
Okay. I would jump in just to say it seems rational to me, the approach you're taking, in that we don't really gain very much by issuing a ticket. And I don't think that's the goal here. The goal is to try to influence the behavior, and just that the public understands and knows that the county is acting, hopefully will guide people to being more careful. Certainly if you issue a ticket, but they've spread the COVID-19 to lots of different people, you're not really that much farther ahead. You know, it is the timely recognition of the problem and trying to get the behavior change. So I agree completely with what you're trying to do. Martha, is your hand still up? You've remembered?
Yeah, I remember.
Okay.
Yeah, and to follow that up, and that sort of the reason for people, for this information to go out on a regular basis so that people know that that enforcement is happening would help change that behavior maybe. If you walk in, this I get to Derek, if you do walk into a party and there are no masks, etc., does anybody take time to get a list of the people who are there in case there is any positive case, and that would make contact tracing easier to do?
Yeah, there's ample room on the form to provide a list of names. So yeah, we are encouraging them to get as much information as we can to assist the health department. Absolutely.
Okay,
Yeah.
Great. Thanks so much. Appreciate it.
All right.
Thanks, Rich.
Okay, anybody else? Again, thank you for all the work on this. I know this is new and different and hard, but I think it lends a lot of credibility to what we're trying to do in our community to keep people safe. So, Jason, do you have any update on the, this is a rhetorical question because I already know the answer here. Do you have any update on the police reform process for the governor's Executive Order 203?
Yes. So as you know, we've been working to try to develop a process, really focusing on a good process to involve the public and an active engagement process. we've met several times, Sheriff, myself, Amy, you, Rich, Leslin, Lisa, to try to map out that process. And also have been at the same time trying to extend and reach out to partner with the city in a more collaborative effort. So about 2 weeks ago, I was able to connect with Savante on a joint venture where he had a relationship with a group called the Center for Policing and Equity. It's a group that has definitely worked on with departments across the country related to race, related to changing cultures in departments based on community needs. We had a joint conversation with them, CPE, Center for Policing and Equity, had a good meeting with them, and then talked about how we could do this from a collective effort. And they agreed that being the two largest agencies in the county from a law enforcement perspective, it made sense to do it together versus doing it separately. So we met with CPE, had some good dialogue, and then we brought our leadership teams together last week or this week. I don't remember what day it was. Maybe it was this week, and had a little further conversation about the group and really what were next steps. So leadership teams seem to be on board, partnering with the mayor, Shelley Michelle Nunn, which is the human resource director, as well as Chief Nair from the city PD, and Travis Brooks, the assistant director at GIAC. From the city's perspective, myself, Amy, Lisa, Derek, Jen, Rich, from our side of the house, and Dominic as well participating. And we agreed that I reached out to them earlier this week, and we're going to be setting up kind of a joint meeting again to develop kind of a strategy, a timeline, an approach. Now, CPE brings several elements to the table. They do a data review and a data download of Spillman information, and they start to scrub some data and look at if there's any correlations, any trending with respect to officer responses and types of calls, those types of things. They also will assist us in facilitating community conversations, meaning we're the ones doing the community conversations. They're assisting us in that process. Them not doing it for us. And from there, they help communities walk through strategies and developing solutions that best meet your agency's needs and your community's needs. And we did, talk about early on the differences between the agencies and solutions. While they many times may be similar, they will also be different depending on the agency's need and customer base, so to speak. So I think next steps for us is we'll continue to meet in partnership with CPE, the city, and have the commitment from the mayor that they want to work at this collaboratively, step as we move forward. Start to develop a timeline, then start to bring in other stakeholders for probably smaller conversations and then into larger community conversations. So stakeholders such as prosecutors and public defenders, other stakeholders in terms of certain groups within the community, and then probably our larger community conversations. So I would say in the next 2 weeks, we'll probably have a larger announcement to the greater public about the relationship and the approach moving forward, and then start to engage. I'll be honest, it's been, there's two things that I find that have been difficult in this, and where I think CP brings structure and support because they've gone through similar processes, which is important. I think one of the things we've struggled, as I've talked to a lot of my colleagues across the state that they're struggling with, is that there wasn't, and there still hasn't been a lot of guidance, although the governor did issue guidance on police reform. It's a 100-some-odd page document that really, from my skimming of it, doesn't provide a whole lot of guidance. But there really was no structure to this when it was passed. Well, it wasn't done through the legislative process, which usually provides more structure to it. So a lot of folks are still trying to figure out how to approach things from the best possible venue. CPE can help with that structure and can help bring really, I think, the two agencies together as we start going through this conversation publicly. We'll start mapping out a timeline. Like I said, we'll start to share that probably in 2 or 3 weeks, and then we'll start moving forward. Obviously, the other challenge that we're facing, more so in the county, is we have, COVID-19 response, as we just talked about earlier, and we have our budget process, and we have, staff intricately involved in all of them, as well as trying to do additional things. So I would say I would love to have seen it move a little bit quicker, but I think we're in a good place now. I think we've got a good team to try to develop that, and then starting to open this up to public dialogue will be an important piece and an important first step as we kind of go through this. So I think that's about the best I've got right now. Rich, Derek, or Amy, or Lisa, if they're on, if you want to add anything, please do. If I missed anything.
Okay. I would just say I support trying to do this in a coordinated way. My great fear is that anybody who's in the community and interacting with police does not differentiate and say, oh, this is a Cayuga Heights police, officer, or this is a sheriff's deputy. They see it as an officer. And the closer we can come to a coordinated response across all of the police agencies, I think we're going to have a far more effective end result. Plus, you have this whole issue of reinventing the wheel. There's every police agency and governmental agency across the state now trying to do what is police reform and trying to figure it out. We will get economies of scale, I think, in doing it together. And we're probably going to be able to provide, if the city and the county do it together, far better assistance to the towns and villages. So we should end up with better product across the board. I see Ann Corman, you're up.
Thank you. So my answer might have just been stated when Rich was talking, but Jason, and maybe I missed it. I just want to be sure that this is being coordinated with all the municipalities. I'm mostly talking with IPD, but I wanted to make sure.
No, not yet. Well, Jason, go ahead.
No, I mean, that's an important piece that we're trying to figure out how to ensure that everybody's incorporated in. So, and yes, that's still our intent. I think structurally, we just have to figure out how it works. But our intent is to bring in the other agencies if they want to participate.
So have they been communicated with at all? Because I'm wondering, are they doing their own thing, or have we talked to them at all?
Yeah, we did. We have talked to them a few weeks ago. We have not circled back with them after this last conversation, and we will once I think we have our first group discussion about timeline and how to move forward.
Okay, so they know what you're doing and they know you'll work with them. Okay, thank you.
Martha.
Tell me again what CPE stands for, Jason?
Center for Policing and Equity.
And is this a nonprofit or something?
Yes.
And I'm gonna take a wild guess and say this is probably not free.
It is.
Oh, okay.
They have a large funding source, and part of their approach to things is they don't want their service to be paid for because they don't want it to be bought. They're providing their service free of financial commitments. So.
Fantastic. Okay. Thanks very much.
Sure.
Rich, I had a quick question.
Yeah, go ahead, Anna.
I'm curious, the culture of the different law enforcement is quite different in how they approach, and frankly, efforts and relationships with the municipalities. I'm curious what work might be happening or discussion might be happening about how to coordinate, I guess, the relationships with the community, outreach with the community, what relationship we want to have with community, what that looks like. Is there a discussion that you all feel, I guess, is effective or will be effective through this process so that those are maybe a little bit more aligned? Because that is a concern of mine.
I thought you said a quick question.
Well, let me rephrase that, Rich. An important question.
A long question.
It's a good question because it's something we've talked about. I think there are overlapping elements of community dialogue that are important, and then I think there are also individual agency cultural questions that are unique to them. So part of what I think they also do will be some internal surveys of each agency separately. So there is some collective work, and there is definitely some separate work to be done.
Yeah.
Okay.
Does that help? Does that answer your question?
I think that's worth a continued conversation about, I guess, but thank you.
Yeah, I think undoubtedly you add complexity in trying to do this with the city and the county and hopefully the towns and villages. But you're going to, I believe, get a much better result if you at least try to do it that way. Glenn and Mike, I don't want to put you on the spot, but do you have thoughts on this? I guess I just did. Yeah. No?
I'm pretty good. All the questions I had actually were pretty well answered. So.
Okay. Okay. Well, thank you, Jason. Anything else from county administration?
No, I mean, we're meeting, obviously, we're just finishing meeting with on budget matters. I've met with, all department heads, and we'll continue to meet. We're shifting in gears constantly between COVID, between, budget, between other issues as they arise. For example, there was just an announcement today by the governor on, I know this isn't necessarily public safety related, but it is all related one way or another, on mail-in voting, which I'm sure will change things for Board of Elections. So those kind of gear changing constantly is happening all over. Sheriff's Office has been great to work with on this response and enforcement piece, which has been good. I'll also add that yesterday we had our first JEDI team meeting, which is the Justice, Equity, Diversity, Inclusion meeting. Matt's there, Jen's there, part of the group. Amy facilitated a great conversation, and we had over 30 employees from different departments and we have some representation from departments we haven't really had typical engagement with, which means you've got a good group of people that are engaged in the organization. So a lot of things going on at the same time, but positive, and we'll keep moving along.
Okay. Anything specific from a budget standpoint that impacts public safety, or is it just pretty much the same as all the other departments? That
I mean, I'm having the same conversation, whether it's Matt, Brian, or Derek, and and it's just it's difficult conversations there. We're trying to figure out how to make it work. They've all been, everyone's been creative and responsive. Whether it's probation, whether it's DA's office, whoever it is, that they're all trying to do what they can considering the constraints. And I think I shared this with the group yesterday. The legislature is that they understand the stresses of what's going on around them and how it impacts their services. So we're trying to work through that. Kevin and I have a big 2 weeks ahead of us as we put things together, but I don't have anything specific. One thing we'll be talking about is the public safety building capital project. I've had some preliminary conversations with Derek on how we proceed with that, and what might be an alternative to what we're talking about doing. But nothing concrete to share right now. But we'll know more in 2 weeks, and then we'll have good budget, enough meat on the bone to talk about at budget. Put it that way.
Okay.
Or less, literally less. But we'll make it work, right?
Yeah. Okay.
Thank you.
All right. Moving on. Sheriff's Department. Welcome, Sheriff, Under Sheriff. Hope you're doing well.
We're doing great. Thanks, Rich. You have our report. I'm not sure how much more I can really add. What we've already talked about. Our inmate count today is 41. We did see a spike over the last few weeks. A lot of it was state-ready inmates again, but luckily the state is taking them much quicker. We got rid of like 6, I think a week ago or so. Got us back down to 41. So other than that, we've been participating, like Jason said, in a lot of the talks with reform measures. We participated in a Zoom call with the Human Rights Commission last week, which went very well, and also another one with Cornell University. A lot of good conversations were had. So.
Okay. I note you have a resolution. Why don't we take care of that? This is appropriation from contingent fund, replacement pay, reimbursement, Sheriff's Office, document ID 9473. Can I get somebody to move that? Glenn moves, Mike seconds. Thanks. I note this is a pretty large amount. You have 7 people that have been on 207C.
Yeah, our disability issue continues to be an ongoing problem around here, and especially on the jail side, we do have 2 long-term disabilities on the road side, which are pending state retirements. And my understanding is those are backlogged due to everything going on, and it's probably going to be quite a bit longer.
Yeah. Okay. Any questions or comments on the resolution? Are we ready to vote? Glenn? Yes? Mike?
Yes.
Anna?
Yes.
And the chair votes yes. By the way, I just wanted to put on the record, Henry is excused from the meeting today, has to be excused. So that's unanimous. Thank you. Yeah, I would like to just have a brief conversation about jail numbers. The drop, it was 48 on Tuesday, but you say it's down to 41. Were there state ready people, or is that just coincidence that it dropped by 6?
Yeah, like I said, 6 went to state prison on Tuesday.
Oh, okay, okay. You know, I had some conversation about trying to figure out, we were substantially lower than 48 for a good period of time, and it seems like some of that is related to COVID. And I had talked to Lance and Matt about what might be happening with the court system, and I'd invite them to jump in and share with us what they think is happening as well. But Sheriff, do you have some thoughts on why the numbers went up?
Yeah, it seemed like we had a little surge in some violent crime going on just recently that resulted in a number of arrests. And Matt can add to it, but I'm guessing that, you know, grand jury's going to be started back up. We're probably going to see our numbers increase as a result of that. I know he was backlogged quite a bit with grand jury.
Yeah, Matt?
Yeah, thanks, Rich. That's true. Derek's right. I think it was 3 weekends ago. Each of the major agencies, sheriff, state police, and city of Ithaca, all had at least one major crime that happened over the weekend that resulted in several people being remanded to the jail for violent crimes. It was 6 armed robberies, the three done by one individual and 3 done by another individual, violent stabbing in Dryden, and a home invasion in Enfield. Those are totally unrelated, but you know, that's kind of how it sometimes works with cycles of crime, is that we have a quiet period where nothing much is happening, and then all of a sudden stuff just starts happening all at the same time. So that was a major contributor to the higher jail numbers. And we are also now back to being able to do grand jury and are able to move some cases along. You know, there was a case that a lot of people in the community know about that was an individual, an auctioneer, who stole about $1 million from many different people. And he never made any efforts whatsoever to pay back any of the money, despite our repeated attempts to try to negotiate that kind of resolution so we could make our victims whole. His case was finally resolved today after many months of waiting, a lot of which was related to COVID. So, you know, we've just been unable to close cases because the courts haven't been operating, and now they're moving back towards a resumption of, we've resumed a lot of court operations. We'll be able to have a trial next month. So we're making it work, but that was a contributor to the lower numbers for a while.
Yeah. Lance, do you have something to add? I thought Lance was with us. I saw his, yeah, there he is. Yeah, you're on mute right now, Lance.
Rich, can you hear me now?
I can hear you. Yes.
Okay. Sorry, the system was blocking me. No, I think basically, yeah, I'd agree with Matt and Derek. We had a little bounce in violent crime and domestic, you know, as we talked about domestics that produced cases that made people jail eligible. I think that'll probably settle down. We have some increased warrant activity and so forth. I don't know that we'll drop back down to where we were, you know, before, but I expect we'll drop a little bit. And some of this is, you know, we're seeing some of this violent crime too has at least indirect relations probably to COVID, in terms of some of those people used to be employed. You have people with relapsing and so forth. I think part of the stresses that produced this kind of burst helped contribute to this burst, trying to figure out why did it happen when it happened. All of that. The domestics, I think similarly, we see the burst, we're what, 6-7 months in, so not unexpected, the stressors all work on people. So I think we see that. I would expect it to slide back down, but not to our lows.
Okay. Martha,
Thank you. How about overdoses? You just mentioned relapses. Any of you, are you hearing news stories about people who've been not able to access treatment or counseling and seeing a lot more overdoses? Are we seeing that?
anybody?
I assign counsel. I haven't seen cases, an abnormal number of cases, of arrests or anything. So we don't have any indicators on that.
Yeah, we don't.
Sorry, Derek.
Yeah, we haven't seen anything noticeable as well.
I mean, there certainly have been some overdoses that I'm aware of, but I don't think it's any more than, unfortunately, the normal numbers that we suffer from.
All right, and if a state police car officer responds to an incident and there's an arrest, that then just feeds into our system, is that right?
It comes to my office to prosecute. It doesn't necessarily get recorded in Spillman.
Okay.
But it probably shows up in Brian's data.
And if there's but if there is an arrest, then that person gets booked through the sheriff's department, et cetera. And there's not a state intake system, I guess is what I'm asking.
If the state police make an arrest, they would process them through the state police barracks, not through us. We receive calls in Spillman. We have indication from dispatch receiving the call, and that's entered into the Spillman records management system. But if the state police respond, we don't get anything further after that. They use their own records management system, unfortunately.
And do you, and I had some communication with you about the case in Dryden. So then you don't end up knowing anything automatically about what happens with the disposition of that?
No, very, very rarely. The state isn't very good with, or have the ability to really share anything with us.
Okay. All right.
But if they were remanded into custody, they would show up in our jail numbers, and that's what's happened, right?
Yes.
Okay. Thank you.
Martha, I just comment, you raise a good point about overdoses. We've had extensive discussion about how do you really count that the 911 calls are clearly not all of the incidences where people are overdosing. There can be people who are taking Narcan independently or recover without Narcan, or, they pass away, but they're not diagnosed as an overdose situation. I'm wondering, with all of the efforts we've made for harm reduction and MAT, medically assisted treatment, are we seeing any change in those numbers? Matt mentioned the numbers fairly normal, and I agree, it's held pretty steady, but we haven't seen this number changing. And I think that's an area where we might want to make further inquiry, is why isn't the number going down? That, are we having any positive impact from all the things we're doing to try to provide alternate treatment method? Anyway, that's a discussion for another day, but I did want to bookmark it. Anna.
Yeah, one question. Curious how so it was mentioned that there were 2 people who were involved with 3 separate robberies each. And I'm curious, I'm assuming that by the way that that was outlined, that they were brought up with charges each time individually and then subsequently were found to be involved in subsequent robberies. I'm curious, I can't remember how the bail reform system works right now. I mean, how bail works now with the bail reform. Are they eligible for
Can I interrupt you? Because
you know what I'm trying to ask.
sure, and that is not the case. What the case is that when the police solved the robberies, by the time they were solved and had enough evidence to charge someone, that individual, each of them had done 3 robberies.
Mm-hmm.
So they hadn't been charged and released and then committed another crime.
Okay.
So
They
bail wasn't,
3.
sorry?
They were charged with all 3 at the same time because all the cases were open and being investigated, and they were identified to have been involved in 3 each.
Well, we know they did 3. We have enough evidence to charge them each with 1 right now, and they're collecting more. Police are collecting more evidence to charge the other 2. But you know, that's not uncommon. When everybody has a mask on, you know, it makes it very difficult to identify people. So you have to rely on other evidence, video surveillance, and you know, other things that you can use to piece together a case. But I mentioned there's 2 individuals. One is in jail now because bail was set, and one is a 15-year-old. He is in juvenile detention because we don't put juveniles in jail.
Right. Great, thank you. And my other question is related to domestic violence. That's something we've been tracking in this committee, and I'm curious, Derek, if you could give us an update, you know, not necessarily on the numbers because that gives us one figure, but I'm interested more in what collaboration with the Advocacy Center and what work is happening with those who are experiencing domestic violence.
Yeah.
What you've seen.
All the domestic calls we go on, we provide them resources, connecting them to the Advocacy Center, and copies of our domestic incident reports actually also get shared with them. So we do have that connection where they're seeing what we're seeing and could follow up in that manner to provide victim services.
And are you finding that there's a reduction in repeat offenses?
Yeah, that I can't really comment on. I'm not sure. Law enforcement definitely doesn't track repeat offenders in that fashion. That would probably be more a question for them. I mean, obviously we see the same players a lot in all types of things, but yeah, I'm not sure on that.
I could add a little bit. I mean, I could say just through scanning some Spillman reports, I have seen a lot of violations of orders of protection as of late. So those are obviously repeat offenders. And an additional resource, we've been working with the Advocacy Center about getting a resource card. It's something that we could leave with the victim that outlines the Advocacy Center number, just different crisis numbers. So we make sure that the deputies know to leave that with the victim when safe to do so. We've also worked with the Advocacy Center, and they were able to give us cards that look inconspicuous, so that if they were found by the offender, they wouldn't necessarily think that it was a resource card for Advocacy Center resources. So depending on the situation, we make sure we leave them with some sort of resource numbers to certain resources.
And that was my concern, is that we might see an uptick in repeat offenses. Matt, I saw you shaking your head earlier. I'm curious if you had anything to add.
Well, I think that's also a cyclical trend. But I have seen repeat offenses of violations of order protections. I would say that there have been several cases where the same individual has committed follow-up crimes that weren't necessarily something that were bail eligible, So they're getting out and committing more of the same kind of. A lot of times it's just a violation of an order of protection by texting or calling or doing something nonviolent, but it's still a form of domestic violence.
Yeah, my concern, I've heard that is a trend that is happening during COVID, and that it's hard enough to make a call the first time as a victim, to have to continue to make the call and for your own protection. The mental health implications of that can be kind of severe. And so my concern is that repeat offenses can escalate to something violent. So if we are tracking any patterns of repeat offenses, that it could be preemptive. That was something that's been on my mind.
Okay. All right. Anything else for the sheriff? I did have a question about the tablets that you're using for the inmates. Are you now doing in-person visitation? Is that back up, or are you using the tablets, and how is that going?
Yeah, the visitation's been back up for a little while now. Everything's going fine with that. The tablets are also in place. I don't think they're doing visitation on those yet. Yeah, they're not quite doing visitation on that yet. That will happen in the near future. But they have access to the tablets for other things, Khan Academy and all that.
Okay. And they're functioning okay?
Oh, yeah, absolutely.
All right. Okay, anything else for the sheriff? All right, last call. Let's move on to the district attorney. We've already heard some of your report, but anything you want to tell us?
Well, as you know, we share this courthouse with the state Office of Court Administration and state employees such as judges and court clerks. We have been using the main courtroom for grand jury, which is the only real space in this building that permits us to be socially distant or physically distant and really observe our safety precautions with putting 25 or 26 people in a room. That has worked out fantastically. We've been using it for the last month now. I was informed last week or 2 weeks ago that the state is not going to let us do that after September 9th. So with some help from Jason and ultimately some real great cooperation from the Office of the Aging, from Lisa Monroe, we're going to use part of their building for grand jury proceedings in September. And that will permit us to continue to have physically distant grand jury proceedings. But we had to get a little creative with that, and that's going to work out, I think, very well. But, you know, this is one of the things that, you know, we deal with in this courthouse, going even back to when some of the court officers were diagnosed with COVID. Office of Court Administration is very good about informing their own personnel, but they don't tell us, the county employees in this building, much of anything. So we found out a week after everybody else in the state knew that these court officers had tested positive. So that's, you know, I guess par for the course. But we are able now to catch up on some of the major cases that have come in and present them to the grand jury and move cases along. And we expect to start having jury trials at some point in October. Those are going to be much more complicated because of COVID concerns, but that's a good sign that we're going to start doing those. And as far as the other, you know, alternatives to incarceration, mental health, wellness and recovery court is up. It's mostly by Zoom. Treatment courts are going by Zoom. We're fully engaged in those, and those are active, going on with the business. So, you know, we're making it work.
Okay. Any questions for the district attorney? Okay. Department of
Rich?
Emergency. Yeah. Oh, yeah.
Yeah, I
Mark,
just wondered,
go ahead.
yeah. Sorry, why, Matt, what was wrong with using the main courtroom?
Well, the state has priority over this building, and they want to use that room for a civil trial. So they're basically telling us they can't guarantee that we can use that room, so you better find another place. And I think that's, in general, we share the building, but if they want it, they can have it over us.
So are you using this for the back part, that open space in the?
Yes.
And
Yes.
do we have security concerns? Is there extra measures we need to take for security?
A grand jury is not a proceeding where the defendant is normally present. More of an investigative function where everybody's kind of on the team for the most part. If there were to be a defendant to testify, then we would have to probably, if they were coming from the jail, they would come with sheriff's deputies. But certainly plan for that if it happens.
Okay.
That part of the building in the Office of the Aging is actually separate from the rest of the building.
Right.
So it's pretty easy to separate them from each other.
Okay. Thank you.
And just for clarity, a defendant has the right to appear before the grand jury, but almost always does not. So
Right.
It's a rare circumstance. Anything else for the district attorney? Okay, Brian, welcome to the meeting.
Thanks, Rich. Just a couple of quick things before I get to the Tomstad report. Our office continues to support the EOC and house the EOC. We've been assisting with the enforcement efforts that you guys have already talked about. We had to create new nature codes for public health complaints. So we're tracking those daily, and also noise complaints, because the two kind of are very closely connected. One can be one and one could be the other. So we're tracking them both. We are continuing with the logistics efforts, handing out supplies and so forth. That's gone down quite a bit. But we still are handing out supplies, and who knows what's going to happen here in the future. Also helping out with the after action report, or kind of the mid-action report, I guess, with regards to COVID, and also the reimbursement efforts through FEMA as it relates to COVID. Other than that, we're trying to get back to normal work, working on our various projects and so forth. As far as the Tomstad report, Martha, to your question, last month's overdoses were down just slightly from the 5-year average from July of the previous 5 years. I can't remember if there was another specific question as it related to items contained in the Tomstad report. I know that you did, someone did mention domestic violence complaints, and yes, they are certainly up, complaints to the center. And they have been throughout COVID. As a matter of fact, I had a little bit of extra time prior to this meeting and did some quick math, and I went from the 1st of March until the end of July, and overall domestic complaints received into the center are up 23.4%. So if there's any other questions or anything having to do with the Tomstad report, I'll try to interpret them. Again, don't shoot the messenger. We just get the complaints.
That's right, Brian. Any questions or comments for emergency response? Okay. Brian, thank you for what you're doing. It seems like this is a difficult time for all the communication efforts we're engaged in.
Yep.
So keep it up.
Is anybody else enjoying the dog show?
Yes, he's trying really hard to
Okay.
get me to play right now. So
Yeah, we're a dog friendly public safety committee. It's, you know, it's okay.
good.
And we certainly want to be.
There's another one.
Actually, a quick question.
Okay, Anna?
Actually, it's just a comment. I just want to note the reason that I am belaboring the domestic violence is, you know, it is up 24%. To me, that's really disturbing. I would like to see us, you know, yeah, we have to do a budget cut, which in and of itself is very concerning. But we also have to simultaneously serve the public good, and we have an identified problem. So I don't know what the solution is. It seems like coordinating with the advocacy center maybe more directly as a county. You know, Derek and I have spoken about, you know, having staff sufficient to do an analysis of trends or being able to track or trace. But I just want to recognize that there is a serious problem that COVID has brought to the fore that is not acceptable. I mean, it's not acceptable at any level. And I don't know, Jason, what that looks like, you know, in the face of a 12% budget cut. But at the same time, let's at least note that we have a notable problem.
Just on that note alone, you know, I asked Brian earlier today for some data on domestic violence. We're collecting data from what Kit is seeing in her, and, you know, at her place with respect to CPS cases, increases in TA, HEAP, you know, SNAP, those types of things, to try to get a global picture as to what's going on and what, you know, try to get a better understanding of things and what type of impacts we're seeing, and this may be able to help us plan for the future. So it's something that I'm aware of, we're talking about as we're putting the budget together. And, you know, it's a little bit, the challenge is just not a budget cut as in the traditional sense. I mean, everybody's dealing with these constraints, just not us. So it's a challenge of trying to address it, but I recognize it. And, you know, we're collecting some information and trying to understand a little bit more and see where there might be solutions.
And I bring it up because we also know, I mean, public health wise, it creates mental health issues, reduced job, you know, consistency, loss of job, loss of financial security, issues with children, mental health issues. So, you know, the repercussions to society are way more than just a single domestic violence case.
No, understood. Yeah, we agree.
Okay, thank you.
And I certainly share the concern with the dramatic budget issues we're going to have to address. You know, I'm not sure that spending more in this area would lower these numbers we're seeing in Tomstat. It might help us in our response. One interesting thing that I think we learned with the visit from the Advocacy Center is their funding model with New York State relies on them filling beds, that they draw revenue when they have people in the shelter. And ironically, during the pandemic, while they had more incidents, they had fewer people in the shelter because of fear of COVID, which drove their revenue down. You know, I think that's certainly outside of our control, but it's an interesting problem.
Yeah, and we are in a budget cut, Rich, for sure. It's not necessarily that I'm saying more money should be thrown at this. What I'm saying is that any money that we do spend, any budget we put together is a reflection of our priorities, and we've identified something that is a serious problem. Whether it is something that, you know, we do more efficiently, it is a redistribution, whatever it is, I do just want to make it clear that I recognize and, you know, and I appreciate, Jason, you noting, you know, there is that recognition that this isn't something that can go ignored. What the
I agree with you, Anna. I agree. Yeah. Jason, you had something further?
Just, you know, on that note, you kind of covered a lot of, you know, social concerns that are a direct impact of the current circumstances with COVID-19. And one thing I'll add is that, you know, K through 12 going back to school is going to be important. It's going to be important because the children get a lot of support services through the school districts. We're able to provide services through the school districts, and when they're not in session, we can't provide those services. So I say that only because we are doing everything we can as a county to demonstrate to the community confidence and effective leadership in managing the disease, and as well as trying to manage the after effects or the impacts of the disease in the community. I bring this up only because that's going to be a big point of discussion in the upcoming 4 weeks or so. And the value of students going back to school K through 12 is critically important. And I personally think, and I think our folks, our staff would agree, that if that doesn't happen for another semester or 2 semesters, all of these it'll have a negative impact on the social issues we just talked about, which is only going to exacerbate everybody's challenges. So I just say that just as it's something we're cognizant of. It's something that the school districts are cognizant of. We've just had this conversation with multiple school districts just as the past week. I think they all agree it's a better environment for the students and for the youth to be in school. But we're trying to work as hard as we can to ensure a safe environment, and that the community is confident that it's safe to send the kids back to school, because this youth in need get a lot of support services through the school districts. And I think everyone in this, everyone on this committee will have an increased workload as a negative effect of school of youth not being back at school through K through 12. I just plant that out there, and we're going to continue to work obviously with all our partners to ensure that there's a safe environment to it. But that will be an exasperating issue if that doesn't happen.
Okay. All right. Anything further for emergency response? Are we ready to go to probation? I think so. So welcome. Is it Carla?
Yes, good afternoon. Thanks, Rich.
Yeah.
So I'm going to apologize in advance if I repeat anything that Dan may have already brought before the committee. Just to give you all a brief update, our numbers are still on the low side, which is to be expected. As Matt has said, there's a lot of cases that are still out there pending that are finally starting to come before the court. So I do expect to see our numbers start to go up, not drastically, but I do expect to start to see them go up. Our community service program is back up and running, which is huge. We have a lot of people on probation that were asking about that, eager to get their hours done. So we did resume that, but it's very limited. It's only 4 people per day. We have 2 work project supervisors and 2 vans. So we're only allowing 4 people. That way there's 2 people in each van to allow for social distancing. Our day reporting program, we're hoping to get that up and running September 8th. There was some correspondence I know Dan had sent out to the judges because it's going to look a lot different. What we're doing is we're limiting it to 6 people at a time, and we're asking the courts to only put those people in the program for a maximum of 5 days. We know that that's a lot less than we would normally do, but we figure at least this way, we can work very intensively with those 6 people, get them connected to the services that they really need, get them into treatment, send them over to workforce if they need a job, those sorts of things, really work very intensively with them. And then at the end of those 5 days, they would move on, so then we can bring in more people. We don't want to, typically it would be 30 program days that we would allow someone to be in the day reporting program. But if we're only allowing 6 people at a time, that would significantly limit. I think we would end up with a big backlog of people waiting to get into the program. So we're going to start with just 6 people at a time, and it will also only run until noon. It used to run until 1:30 in the afternoon, but we're going to end it at noon. That way we don't have to worry about providing lunch. We can just send them on their way. They can go do what they need to do for the afternoon. I'm trying to think of what other updates we have. We did the entire department. I think Dan mentioned this last time that we were going to do an implicit bias training for the entire department. And we did do that on July 24th. It was a training regarding implicit bias in the criminal justice system. So it was very specific to what we do. It was quite long. It was about a 4-hour training, but I think it was really well. I think it was very well received by the staff.
Okay. Questions or comments for probation? It does seem that it's a day-to-day process over there on what all the changes are bringing.
Yes.
I would think getting day reporting open would be a really positive step if you can manage it.
Yeah, we're excited.
Okay. All right. Anything else for probation? I think we're at the point, Lance, assigned counsel. Welcome. I know we talked to you earlier about jail numbers. You and I had spoken earlier a little bit about just the general trends with assigned counsel, and maybe you wanted to share some information there.
Oh, sure, I can. I think we've shared these numbers with administration. I think as some of the legislators know, our numbers are way down for the year. Probably a couple of causes. One of those are COVID. You saw that in our, returning money from our budget that we knew we weren't going to use. We've seen a slight increase or a bump as court operations have resumed. You'd kind of expect that, but historically, our numbers are still low if you look back over the past several years, month by month. So we're still below our historical numbers. And, we'll track that. We'll see where we're at in September, October, see if we're regressing to the norm or not. But right now we're still low, even with our uptick. That's the other thing. The other thing, I guess, people talk about implicit bias. We've had a CLE set up for that for our panel attorneys. We focus mainly on our panel attorneys, which is our big public interface. We're in the process. We're going to require all of our attorneys are going to take a series of implicit bias tests, the Harvard implicit assessment tests. They're an online tool. They're really an excellent tool that's used a lot by a lot of public defenders, by a lot of organizations, HR departments, for their hiring committees. I've done now about 10 of them. They take 10 or 20 minutes. So we're going to require all of our attorneys to do about 10 of those. It's really a tool. Ideally, you'd see everyone in the criminal justice system, judges, prosecutors, police officers, everyone doing it. The value of these tests are they're done online and they're done by the individual, so it can produce a better result. They don't feel like they're sitting there having to conform to a norm. It gives feedback, so it tells the individual, oh, you have a slight bias or a strong bias in this regard. So we're using that. It's part of an ongoing program we have addressing the issue of implicit bias that'll be going on probably for a series of months or over the next year. Those are our other big update is we've gotten and signed the second year of our statewide contract with the state. So that's now in the process of kicking in, which is good news for us in terms of recovering more money from the state. And at this point, they're still paying us our reimbursements. So, fingers crossed, we'll see how long we go with that. But that's kind of our update.
Okay. Any questions or comments for assigned counsel? Okay. Seeing none. Okay. Any other business to come before the Public Safety Committee? Hearing none. Do I have a motion to adjourn? We've had a pretty
Yes.
efficient meeting today. Glenn moves. Anna seconds, right? All those in favor? You can just raise your hand. We'll see it. All right. I see a unanimous motion to adjourn. Thank you, everybody. Stay safe, and we'll talk soon.
Thank you, everyone.
Thanks, Rich. Thanks, everyone.